All right, so picture this. You're just going about your day. Maybe you're stretching or something, and you feel it, a little lump on your neck. Immediately, your mind just starts racing, right? What is that? What happens now? Well, today we're going to walk through that exact journey together. We're going from that first doctor's visit all the way to the operating room to really break down how thyroid conditions are diagnosed and treated. So, here's the game plan. We're going to break this whole thing down into 6 key parts. First, we'll get to know the thyroid itself, the basics. Then we'll step into the doctor's office for the physical exam. After that, we dive into all the detective work, the tests and scans. Then we'll see how doctors put it all together for a diagnosis, what surgery actually looks like, and finally, what to expect with recovery and any potential bumps in the road. Okay, so first things first, what is the thyroid? Well, it's this small, butterfly-shaped gland, and it sits right at the base of your neck. But don't let its size fool you for a second. This thing is an absolute powerhouse. It's basically your body's master control for metabolism, running the show on everything from your heart rate to how fast you burn calories. Now, let's zoom in on a really key piece of anatomy here, Barry's ligament. Think of it as this tough little anchor of connective tissue that tethers your thyroid right onto your windpipe. Now, why does that matter? Well, this connection is the exact reason a doctor will ask you to swallow during an exam. See, if that lump you found moves up when you swallow, that's a massive clue that it's actually attached to the thyroid. And that brings us right to the examination itself. Before we get to any of the fancy scans or high-tech tests, the very first step is a really thorough, hands-on evaluation. Your doctor's going to use some classic, time-tested techniques to get a feel for what's really going on in there. All right, so the first one is called Leahy's method. And what's interesting here is that the doctor actually stands behind you. This position is perfect because it lets them gently wrap their fingers around your neck and get a really, really good feel for the size, the shape, and just the overall extent of any swelling in the thyroid. But, not everyone's neck is the same. What if a patient has a shorter or maybe a more muscular neck? Well, doctors have a specific move for that, and it's called Pizzillo's method. In this case, they'll ask you to tilt your head back. This hyperextends your neck just a bit, stretching everything out and making the thyroid way more accessible for them to feel, again, from behind. It's a perfect example of how these exams are tailored to each person. And then there's a third one, Creel's method. Now, this time, the doctor stands in front of you. They'll place their thumb right over the area, and as you swallow, they're not just watching for movement anymore. Now, they're feeling for the specific texture. Are there any bumps, any nodules on the surface of the gland? It's a completely different perspective. Okay, so once the physical exam is done, the real detective work kicks in. The doctor has some initial clues, right? But now they need some hard data to back it up. And this is where we bring in the big guns. Blood tests, scans, and other investigations, all designed to build a complete, detailed picture of what's happening. The first stop, pretty much always, is a simple blood test. And what we're looking for here are the levels of some key hormones. Think of it like a conversation in your body. The pituitary gland in your brain is the boss, and it sends out a message, a hormone called TSH, to tell your thyroid what to do. Now, if your thyroid is being a bit lazy and not making enough of its own hormones, T3 and T4, the pituitary has to shout louder. It releases more TSH. That's hypothyroidism, an underactive thyroid. But if the thyroid is going haywire and is overactive, the pituitary gland just whispers, releasing way less TSH. And that's hyperthyroidism. It's a really elegant feedback loop, and it's an incredibly powerful tool for diagnosis. All right, so if a scan is the next step, doctors often use a special trick. The thyroid naturally loves to soak up iodine, so they use radioactive iodine isotopes to get a look inside. But, and this is key, they use 2 different kinds for 2 totally different jobs. You've got iodine-123. It has a really short half-life, so it's perfect and safe for a quick diagnostic scan to just see what's going on. Then you've got iodine-131. This one is way more powerful and sticks around longer, so it's not for looking, it's for treating. It's used to ablate or basically destroy cancerous or overactive thyroid cells. And ultrasound is another huge piece of the puzzle. When the radiologist is looking at the screen, they're basically on the lookout for a checklist of suspicious signs. Things like, is the nodule darker than the tissue around it? Are the borders jagged and irregular instead of smooth? Are there these tiny little specks of calcium in there? Any of these things on the list are considered red flags, and they'll definitely raise suspicion and point towards needing more investigation. Okay, so we've got the physical exam, the blood work, the scan results, all these different pieces of the puzzle. So what now? Well, the next stage is all about putting those pieces together to build a single, clear picture. This is how we get to a definitive diagnosis and figure out a solid plan of action. And a big part of that plan often comes from something called a fine needle aspiration, or FNAC. It's basically a very small, precise biopsy. What's so cool is how the results are classified. You can see it here, from Thai 1 to Thai 5, and it basically creates a super clear roadmap for what to do next. For instance, if you get a Thai 2 result, that's benign. The plan? Just keep an eye on it. But if it comes back as a Thai 4 or a Thai 5, that's a much stronger signal that, okay, surgery is probably the right move here. All right, so for many patients, the path does lead to surgery. And look, that can sound pretty intimidating, right? So let's pull back the curtain and demystify the whole process. Let's take a look at what actually happens inside the operating room during a total thyroidectomy. The whole procedure is just incredibly precise and methodical. At its core, the operation is all about carefully ligating, which is just a fancy word for tying off all the blood vessels that feed the thyroid. And there's a very specific order to it. Surgeons always start with the veins. Why? Well, this prevents blood from getting trapped and pooling up inside the gland when they eventually cut off the supply from the arteries. Once the veins are handled, then they move to the arteries. It's a super systematic approach, and it's all designed for maximum safety. And once the surgery is over, the journey enters its final phase, recovery. This is all about healing up from the operation, but it's also about keeping a close watch for any potential complications, the very things surgeons work so meticulously to avoid in the first place. And this is where you really get a sense of just how delicate this procedure is. I mean, look at this. Every single potential complication is tied to a very specific tiny piece of anatomy. A hoarse voice? That could be from an injury to one nerve, but losing your vocal pitch, that's linked to a completely different nerve. And then you have hypocalcemia, low calcium levels, which can happen if the tiny little parathyroid glands hiding behind the thyroid get damaged. It just goes to show you the incredible level of precision the surgical team needs to have. So it all kind of leaves you with this one big question, doesn't it? When you think about how packed the neck is, I mean, it's just this tiny space crowded with vital nerves, glands, and major blood vessels. How do surgeons pull it off? How do they balance the need for complete removal with the absolute necessity of preserving every single one of those critical functions? It's really not just about taking something out, it's about what you leave behind. And that is just a mind-blowing testament to surgical skill, deep anatomical knowledge, and incredible precision.